You know, we all think we know what acne is. But what if I told you that sometimes it's not just a skin problem, that it's actually a clue, a signpost for something much, much deeper? Well, in this explainer, we're going to uncover when this common condition is hiding a more complex secret.
So, let's kick things off with a number that might just surprise you. Up to 15% of severe acne cases, they aren't just about clogged pores. They're actually a sign of a deeper, systemic issue. And that means they need a completely different way of thinking when it comes to diagnosis and treatment.
So that's the big question, right? How do you spot the difference? How do you know when a breakout is more than just a breakout? Let's play detective and dive into this diagnostic mystery. Okay, our first clue takes us into the world of what are called auto-inflammatory syndromes. Now, this is where the body's own inflammation system pretty much goes rogue. And the skin? Well, the skin is often just one of the crime scenes.
So let's look at our first major suspect, something called SAPHO syndrome. And this acronym, it just lays out all the clues for us. Imagine a patient comes in with really bad cystic acne, but they also mention this nagging, deep pain in their chest wall. They would never think to connect the two, but that's exactly what you need to do.
And here's the really interesting part. Patients almost never connect these dots themselves. A teenager might just brush off joint pain as growing pains. An adult might not even think it's worth mentioning to their dermatologist. This is why a super detailed history is absolutely crucial. You've got to ask the right questions to find those hidden links. Now, SAPHO doesn't act alone. It's part of a whole family of syndromes. Take a look here as we compare it to its close cousin, Papa syndrome. You see the similarities, right? Severe acne, joint problems, but the details are different. The type of joint issue is different. The other skin manifestations are different. It's a different set of clues, all pointing to a similar kind of problem. Okay, let's pivot. Our next set of clues isn't about the immune system going haywire. Nope. This time, the culprit is hormonal, an internal imbalance that's sending out distress signals that show up on the skin. We're talking about the endocrine system. And here's the deal. A whole host of hormonal conditions can show up as acne. The big one you'll probably see is polycystic ovarian syndrome, PCS, which is super common. But, and this is a big but, if you see acne suddenly explode, really severe, and it's accompanied by other signs of virilization, like unusual hair growth, well, that's a major red flag for something much more serious, like a rare adrenal or ovarian tumor. All right, get ready for a plot twist. Sometimes what looks exactly like acne isn't acne at all. It's an imposter, what we call an acneiform eruption. And luckily for us, there's one dead giveaway to tell them apart. And this is it, the single most important tip right here. True acne has comedones, blackheads and whiteheads. These acne imposters, these acneiform eruptions, they don't. It's a subtle clue, but it's the one that changes everything. So what's causing these lookalikes? Well, very often it's medications. We're talking about common culprits from steroids all the way to newer cancer therapies and JAK inhibitors. And another giveaway is that unlike regular acne, where you see a mix of pimples at different stages, these eruptions are often monomorphic. It's like all the bumps showed up to the party at the exact same time, wearing the exact same outfit. Okay, so we've gathered our clues. We have the autoinflammatory syndromes, the endocrine red flags, and the acne imposters. So now let's assemble all of that into an actionable toolkit for clinicians. A set of red flags so you know when you need to dig deeper. Honestly, it can all boil down to asking 4 simple questions. 1, when did it start? Was it really early or kind of late? 2, are there any other symptoms going on, no matter how unrelated they seem? 3, is there a family history? And 4, and this one is huge, has it been stubbornly resistant to all the standard acne treatments? If you get a yes to any of these, it's time to start investigating. And this comparison just lays it all out, doesn't it? On the left, a standard, even if severe, case of acne. But on the right, that's the profile for syndromic acne. The differences in timing, the systemic symptoms, and how it responds, or doesn't, to therapy, that's what separates a straightforward skin case from a complex, multi-system disease. So why does all this matter so much? Because the delay in diagnosis here isn't just about a delay in getting the right cream or pill. It's a delay in treating a potentially destructive condition that's happening inside the body. You're not just missing the diagnosis, you're missing the whole patient. Think about it like this. Let's look at psoriatic arthritis.
We now know that because we can diagnose it early and we have incredible treatments, the severe deforming joint damage that used to be common is now rare. Well, the exact same principle applies here. Catching something like SAPHO or Papa syndrome early on can prevent irreversible harm.
So the crucial point, the big takeaway, is to always maintain a high index of suspicion. The scan can be a window to the rest of the body, and we have to be ready to look through it, which, it leaves us with a final question. For every clinician, for every curious mind out there, what other simple diagnoses that you see every single day might just deserve a second, deeper look?